Welcome to the NBCOT exam practice test. Our topic today is practice test number 3. Use the link in the description to download the app on the App Store for free practice tests. Number 1. A patient presents to the clinic with right shoulder pain and complains of difficulty reaching overhead, with pain especially from 60 to 120 degrees of shoulder flexion. Which special test would be most informative for this set of symptoms? A. Crossover test. B. Near test. C. Empty can test. D. Push-off test. The correct answer is B. Near test. Number 2. A patient complains of weakness in the right hip while she is ambulating. Upon examination, you notice that the patient has a significant drop of the left hip while in mid-stance on the right leg. The most appropriate treatment for this impairment would be A. Standing hip abduction of the left leg. B. Standing hip abduction of the right leg. C. Standing flexion of the left leg. D. Standing flexion of the right leg. The correct answer is A. Standing hip abduction of the left leg. Number 3. A patient presents to the inpatient rehabilitation unit who has suffered a vertebro-basilar cerebrovascular accident and has difficulty adducting and depressing his eyes. Which cranial nerve is the most likely cause of this impairment? A. Trochlear nerve 1. B. Trochlear nerve 2. C. Trochlear nerve 3. D. Trochlear nerve 4. The correct answer is D. Trochlear nerve 4. Number 4. A 45-year-old male presents to the burn unit with partial thickness burns over the entire right arm, left arm, front of head, and front of chest. Approximately what percentage of his body is burned? A. 31.5%. B. 36%. C. 40.5%. D. 45%. The correct answer is C. 40.5%. Number 5. Which condition causes peripheral vision loss? A. Uveitis. B. Cataracts. C. Glaucoma. D. Macular degeneration. The correct answer is C. Glaucoma. Number 6. An elementary school teacher has been recently diagnosed with multiple sclerosis. To accommodate the effects of MS on the ability to teach, the occupational therapist recommends using which of the following? A. A daily list of tasks to compensate for cognitive deficits. B. Large print written material to compensate for visual impairments. C. A motorized scooter to compensate for decreased endurance. D. A high stool to compensate for lower extremity weakness. The correct answer is D. A high stool to compensate for lower extremity weakness. Number 7. A 17-year-old with a complete melaminingocele at the 9th thoracic vertebra is diagnosed with diabetes. The occupational therapy home education program will most likely focus on which of the following? A. Child-initiated pressure relief. B. Regular skin inspection by a parent. C. Upper extremity strengthening. D. Bowel and bladder care. The correct answer is A. Child-initiated pressure relief. Number 8. A patient presents with a stroke involving the hypothalamus. Which of the following are not indicative of hypothalamus function? A. Thirst center. B. Maintains body homeostasis. C. Sensation of pain. D. Control of hormone secretion. The correct answer is C. Sensation of pain. Number 9. A patient presents with an aneurysm of the middle cerebral artery. Which of the following are not aneurysm precautions? A. Limit visitors. B. Limit suctioning. C. Avoid rectal temperatures. D. Avoid Valsalva's maneuver. The correct answer is B. Limit suctioning. Number 10. A patient exhibits signs in increased intracranial pressure. Which of the following interventions are not required? A. Limit suctioning performed. B. Set up a quiet environment. C. Provide minimal sensory stimulation. D. Elevate the head of the bed to 50 degrees. The correct answer is D. Elevate the head of the bed to 50 degrees. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.